So what are the options? Somebody goes to your practice.
Sure.
You can't save their teeth. They need a full mouth of extractions,
Yes.
or they're a denture wearer. What are
Yes.
their options
Yes.
with the dental implants in your practice?
This is what's exciting about this technology, or the options that we have available to us using those mini dental implants. So to start off with, we can place just a half a dozen, a few implants on the lower, another half dozen or so on the upper, put in beautiful dentures that match your smile and look the way you want them to look.
And they what, snap in?
They snap in, snap out very easily, but they don't come out when you're eating. Wonderful.
Okay.
The nice thing about the upper is that nothing to gag you. You don't have that big hunk of plastic in the roof of the mouth that comes with a traditional denture.
Okay.
Because you need suction with a traditional denture, if you can get it, depending on the roof of the mouth. But with a mini dental implant, who cares? They're nailed in. They don't come out. You have to physically take them out. You can bite into your food. And if you like Nathan's hot dogs, you know when you bite into that and it's that crisp taste, those people never experience that. With the mini dental implant and those dentures, you feel that hot dog and that flavor
so they're
burst
locked
in your mouth.
They're locked in.
Exactly.
Okay.
You can feel the taste. You can feel the spiciness. Taste the spiciness, the sweetness, the how warm it is or how cold it is. All those experiences, all those senses, they all come rushing back. Can you imagine not having those senses for years and years and then all of a sudden to be able to taste in that manner? It's unbelievable.
How old can you be to get this done?
I have patients in their 90s having these procedures, only because for whatever reason, everybody has their own situations in their life. They show up and they're ready. What made them ready at 91 or 93? I don't know.
No more dentures though.
But they're there. They made up their mind. They don't want to do it anymore. Once they do it, what do they say? Why didn't I do this sooner? Dr. Frank, why didn't I find you sooner?
So they could bite into like a sandwich and tug on it. No problem.
No problem at all.
What about like a carrot or something with the front teeth?
Absolutely, absolutely. Although in Pittsburgh it would be a pimenti sandwich.
Okay.
Okay. You got to be able to eat that pimenti sandwich. It's just really, really good. Now the good news is this. If you didn't think that was good news, wait till you hear this.
Okay.
So the patient comes back and says, because we have them come back every 6 months, and they say, you know, Dr. Frank, this is great. I really enjoy that. But I remember at the time, you showed me those teeth that don't come out at all. I want to see those again. And remember, we talked about that. And at the time, I know it was a lot less than what I was quoted
So it's
before.
less expensive for the snap in,
Yes,
snap out. Okay.
yes. But the next level is still less expensive than the traditional method that even I used to do years ago.
The bigger implants.
Yes. So what happens is we just add a few more implants. We already have the half a dozen. We put in maybe another 2 on each side, and guess what I can do? We can put in the teeth that are cemented in permanently. So you've already invested in those half a dozen. That never goes away. That's investment. So you reap from that, and we just add a little bit to it.
So you start with the snap in, snap out, and then you can graduate to
Yes.
the fixed set of teeth that don't come out.
Right.
Is that unusual, or it happens all the time?
With the mini dental implant, it's not unusual. If we had traditionals, there'd be no way. It's a one and done.
Be tough.
It'd be tough. Yeah,
Now, is it
can't
true
do
that with mini implants, in some cases, it's like virtually a bloodless procedure? Because you're kind of popping them through the gums?
Absolutely. It's just like putting a screw in a piece of wood. You just have a little drill, a little tiny little drill, a little pilot hole.
Sounds painful.
It's not.
The bone doesn't have a lot of feeling?
We don't even have to numb the patient like I normally would for a traditional. With a traditional implant, or even doing a filling on the tooth, I use more anesthetic to get the tooth numb to do a filling than I do to put in your implant, believe it or not. It's a few drops here, a few drops there. I know I make it sound easy, but I do it all day long. And patients don't feel a thing, and they don't walk out with their lips all over the place, because I don't have to give you those full anesthetic blocks that I would otherwise for other traditional dentistry. It's amazing. It's just amazing. And so that day, you can feel your teeth.
Okay.
Yeah.
So you can do this in one day. Like somebody walks in the morning.
Absolutely.
And in the afternoon, they go home with a brand new set of teeth.
Yeah. I know. Can't believe it myself.